Hello, and welcome to another episode of Crush Cravings Before Diabetes Crushes You. I'm your host, Karen Sammer. I'm a National Board Certified Health and Wellness Coach, and I work with women who are pre-diabetic and overweight to overcome the cravings that keep them stuck so they can lose the weight they need to lose and therefore avoid a lifetime of medication. But today, what I want to talk to you a little bit about is women and our hearts, because there's a lot of misunderstood information out there, a lot of myths out there regarding women's hearts, or, heart health. And so I want to dispel some of the myths, and I want to give you some of the truth of what we need to know. And it is, I'm going off in a little bit of a different direction, but it's not unrelated to what we talk about all the time, which is diabetes and other chronic conditions, because heart disease is about 80% preventable. Heart disease that is not the result of a birth defect or some sort of a mechanical malfunction, but if it is just something that is a result of years and years of lifestyle and nutrition choices, it is preventable. So that's really that. Those are the heart conditions that I try to help people with, is the ones that they can reverse. In some cases, you can reverse or at least mitigate much of the damage, or you can prevent it if it hasn't already come on. So most people don't know, at least in my experience, most people don't know that heart disease is the leading cause of death among adult women in the U.S. And it far surpasses any form of cancer, all forms of cancer combined. Most people think that breast cancer is the leading cause of death in women. That is not the case. It's heart disease. And so one of the myths around heart disease is that it's a man's disease. And it was treated that way for generations. It was treated as though the woman was the caretaker and the man was the one who developed the heart condition, the heart attack, or whatever other situation occurred. And it was never considered that women are as susceptible as men to heart disease. So it isn't just a man's disease. As I said, more women are killed by that than any other cause in the U.S. Actually, I think globally, but certainly in the U.S. And there are many myths around, as I said before, around women and heart disease. And one of them is that we have the same symptoms as men. If we were going to have a heart attack, we would present the same way a man does. And, you see in the movies, I call it the Hollywood heart attack, where a man doubles over, clutches his chest, passes out, and is having his heart attack. Well, women don't necessarily have those dramatic symptoms. We could have the chest pain and the shooting pain down the arm and the jaw pain, but sometimes our symptoms are more subtle. And the reason I know that is because I also had a heart attack. And as we get through this discussion, you'll see what probably caused my heart attack. So when women present with a potential heart attack, sometimes it shows up in the form of extreme fatigue, or nausea and vomiting, or maybe a pain in their neck, a pain in their side. I actually presented with a pain in my neck, a pain in their side. You may get jaw pain, you may get the chest pain, but you also may have symptoms that could easily be attributable to something else. And as a result of that, women are much less likely to seek immediate medical care, because number one, they just don't think it's a heart attack. It just doesn't occur to them that it might be a heart attack. Number two, if they think it could be something but they're not sure, they don't necessarily want to go to the ER and be told that it's nothing, or they're having a panic attack, which is also something that happens. You get into a doctor who maybe has a preconceived notion about heart disease, and if you don't show up as somebody who may fit the profile of someone who could be having a heart attack, you might be young, you might be fit, you might be if you're a young mom or if you seem to be stressed out or something like that, they may attribute your symptoms to something other than your heart and may not take it seriously. And then what happens is they'll send the woman home and she'll go home and die sometimes. And more women than men will die from their first heart attack. And some of that is because they don't take care of it themselves. They don't pursue medical intervention, or the medical intervention is not given to them when they are in a situation where they are asking for help. And so these things, certainly these things make it more difficult for women to be cared for properly. And like I said, there's a lot of innate prejudice, not in the medical community. I think it's probably as new generations of doctors come up, I think that is probably changing because they're getting more and more savvy about specifically women and heart health. But the old school doctors, all of the medical work, all of the clinical trials, all of the medication development, the medical device development, that was all based on the male body. And women are not just men with uteruses. We have much different physiology. We have a different fat to muscle ratio. We have different hormonal profiles. We have different size bodies, different size organs. And it all matters when it comes to medical intervention for a man versus a woman. So, a lot of times throughout much of history, the experimentation in the clinical trials were based on men. And part of the reason for that was women had hormonal fluctuations which sort of skewed the results. But, hormonal fluctuations are a matter of, that is just a fact of life. So they should have been accounted for. They should have been allowed throughout all this time, although it is changing now. Women should have been allowed into the clinical trials at all ages. Because then what they did is they decided to bring in postmenopausal women because they most resembled men physiologically, because they didn't have quite the hormonal fluctuations that the younger women did. But now I think that they're slowly starting to bring younger women into the trials, and hopefully that will start to change the environment. But it's a slow moving ship right now. Another thing they didn't do is they didn't bring people of color. It was all white men, or many of them. Very few people of color were introduced into the trials. And again, there are differences. There are cultural differences. There are body type differences. There are higher risk for whatever reason. People of color are at higher risk for developing heart disease, and some of it is socioeconomic. Some of it is cultural food choices. Some of it is body types, body type preferences, larger body preferences, that type of thing. But all of this plays into the risk factors. But for women, our hormonal changes can give us a unique risk profile if we use birth control. Once we go into menopause, throughout our youth, our estrogen often is very cardioprotective. So it means it helps to keep your heart healthy. But once your estrogen starts to deplete, your risk factors go up, and so that can put you at a higher risk for developing heart disease. Pregnancy issues. If you're preeclamptic or eclamptic during pregnancy, where your heart rate is affected and you're swelling and all of you're not able to remove the fluid from your body so that it impacts your heart in a negative way. These can be a precursor to development of heart disease later on in life. And then if you're stressed or depressed, that also can have a negative impact. Stress is inevitable in our lives. We have stress, but if we don't manage it properly, and you have that constant rush of cortisol and that constant just pressure on your system, that will eventually add to the development of heart disease. Plaque development isn't just because you eat meat all the time. Plaque development can be as a result of the inflammation in your arteries caused by an unrelenting stress that your body is under. And then depression. Women manifest depression a lot differently than men. more women are diagnosed with depression. I don't think that necessarily means that more women are depressed, but women seem to internalize it differently, and it can add to the development of heart disease. But also, when you have these mental health issues, depression, anxiety, panic, whatever that is, they oftentimes their symptoms mimic heart disease. So you don't know if you're having a heart attack or a panic attack. And if you think you're having a panic attack and you just try to ride it out instead of going to get medical attention, then it may possibly be to your detriment. So knowing what your body is going through and understanding the possible symptoms that you're having is very important, and seeking out medical intervention when it's necessary. So some things, one of the things that women hesitate to do is when we're not sure what's happening, we're hesitant to go to the emergency room or go to the doctors, because especially if you have a doctor who has a God complex and makes you feel less than when you go to the doctor and you are telling them about symptoms that they don't necessarily see right now. So you may have had chest pain, or you may have had the shortness of breath, or you may have had whatever the symptom may have been, but by the time you get to the doctor, it may have passed. And if there's no evidence of that, then they may attribute it to something else. And that happens very often. And the more you are treated in a condescending manner, the less likely it is that you're going to go back to that source of condescension for help. So it's really important that if you have a doctor that talks down to you, or if you have a doctor that does not listen to you or won't hear you or dismisses your concerns, find another doctor. Now, there are also other issues around once you get into the medical situation where you could be misdiagnosed. Women are much more likely to be misdiagnosed than men are when it comes to heart conditions. Again, because if you don't fit the profile of someone they expect to see having a heart attack, they may not even look in that direction. So they'll call it something else. And all of the testing that is done to determine whether or not a cardiac event is occurring was based on the male body. So they check troponin levels. They take blood and they check troponin levels, and troponin is a substance that develops in your body when there's heart damage being done. So if that number is elevated, that means that there's something going on in your heart. When I had my heart attack, when I went in, I felt a little twinge in my chest. I happened to be at the hospital at a meeting, which was very serendipitous for me. But I had a twinge in my chest, and I couldn't, I felt like it was almost like a pulled muscle. So I kind of tried to wiggle around, kind of just get it to subside, and it didn't. And then the pain started to radiate to my shoulders and eventually up to my jaw. But at the time, it just didn't feel right. And in the back of my mind, I was thinking women's symptoms are different from men's. That was this loud voice in the back of my head that was telling me that I needed to get help. So I was in the meeting, so I asked the guy sitting next to me if he'd please walk out with me, because something was going on. And I was afraid that, if there was something really bad going on and I passed out, I didn't want to be laying in the middle of the floor in the hospital. So he walked me out. He took me to some of the employees, and they took me over to the ER, hooked me up to an EKG, and I was indeed in the throes of a heart attack. So they took me up to the cath lab they thought they were going to insert a stent to open up a blockage. But what they found when they got in there was I didn't have a blockage. What I had was a spontaneous coronary artery dissection, which is something that's also fairly unique to women. Some men do have them, but they mostly happen in women. And there are no pre-symptoms, so I never had any chest pains prior to that one incident, and I haven't had any since. But it's when a part of your artery, a flap comes down. So what happens is your artery's got like 3 layers. It's in 3 layers. That bottom layer split off and caused a blockage that caused the heart attack. So it caused the blood to stop flowing. Now, fortunately, my body was able to heal itself. It was a small part of a small artery, which is another thing that women are uniquely blessed with, is a lot more micro arteries, I think they're called, in the heart, so that you could have microvascular disease much more frequently than men, which is the smaller arteries in your heart, and they're not necessarily detectable through normal testing because they're tiny. They're not the major arteries. They're not the LAD. They're not the, whatever, all those other major arteries that they typically pay attention to. But if you have this microvascular disease, that could be problematic for your heart. So if you're having something, if your troponin levels maybe don't elevate as quickly as they might expect them to, then they do test you. So with me, they tested me several times during the evening, and because I was having a heart attack, they did put me in the CCU for about 4 days. And as the evening went on, it got much worse. The jaw pain got really pretty bad. They put me on morphine, so everything from here up was hurting, but it was a slow process. And I went through the typical CCU for 3 to 4 days. Then they put me in a step down, and then they sent me home, and I was fine after that. However, that happened midweek. I think Thursday is when I went home. So Monday night I had the heart attack. Thursday I went home, and then Saturday or Sunday I was back in the ER because I was having a terrible stiff neck. It was worse than any stiff neck I'd ever had. Well, it turned out I was having another SCAD, another spontaneous coronary artery dissection. But that manifested itself as a neck pain for me. And when they tested me, and they didn't realize it, my cardiologist figured it out from the testing that they did. Nobody realized it when I was in the hospital, in the ER. And when they checked my troponin levels, they were elevated. But because I guess the EKG was normal, because that's another thing, women can present with a normal EKG while they're having a heart attack. But because the EKG was normal, my troponin levels were elevated, they didn't think I was having a cardiac event. And I was having a second SCAD.
I ain't no psychiatrist, I ain't no doctor with degrees, but it don't take too much time to see what you're doing to me. You better think about what you're trying to do to me, yeah. Think, let your mind go, let yourself be free. Oh, freedom, 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 oh, freedom, yeah, freedom, now
So fortunately for me, I'm fine. I turned out everything, went back to the way it was supposed to be, and I don't have any negative effects from that, which is very fortunate, because there are women who are much younger than me who have these conditions, these SCADs, and they don't always fare as well as I did. And that's the thing also, when a young woman has a heart attack, if she has a SCAD, very often it doesn't come with symptoms initially. You don't get the occasional chest pain, the angina, or any of that, none of the feelings of something going on. It just happens all of a sudden. And if this young woman doesn't realize that it's a heart attack, she could end up not waking up. So women are often misdiagnosed. And by the way, if you have a female doc in the ER, you're much more likely to survive. And that's men and women, because they operate differently. They operate as in they function differently than men. They have a different way of approaching things. They have maybe a little bit of intuition about what's going on with the body that they're dealing with. So the statistics are there, and you're more likely to survive if you have a female doctor in the ER. So all is not gloom and doom. Just so you know. You are, as I said before, 80% of heart disease is preventable through lifestyle and nutrition changes. So what does that mean? Well, you can certainly you make small incremental changes in your life that ultimately add up to big rewards. And those are going to be, so we're going to talk a little bit about some of those techniques. I forgot to mention that. So the unique, I was talking about the unique components of women's risk for developing a condition, a cardiac condition, that aren't necessarily attributable to men. Although, in my case, breast cancer treatment. So I had breast cancer, as I think I've mentioned in previous episodes. I had breast cancer in my left breast. That puts me, so I had both chemo and radiation. And one of the drugs in the chemo cocktail made it necessary for me to have my heart monitored throughout the treatment for enlargement, actually. But that particular drug I was on for a year, and they tested me every 3 months to make sure that my heart wasn't enlarged. And it didn't appear to be. But then 7 years later, I had a heart attack. Again, both chemo and radiation, chemo systemically and radiation in the left breast and under the left arm. So breast and arm, underarm. So that, the heart is right in that line of fire there. It was so it's very likely that the breast cancer treatment is probably what contributed to my cardiac event. And so, at least I'm here. That's all I can say. At least I'm here. So the things that you can do to prevent the onset of heart disease, or if you do have heart disease, you can certainly mitigate the risk of it getting worse, right? Some is progressive, but if you are able to take steps now to correct the things in your life that may have contributed to the onset of this illness, at least you can stop this progression or slow it down considerably. So let's talk about what that is. What does that mean? Now, number one is that you want to know what your numbers are. So you want to keep track of your blood pressure and your cholesterol, and you want to talk your BMI. So BMI is not a really good gauge because it doesn't take into account bone, skeletal density, or it doesn't take into account a lot of things. It's really just a function of weight. I don't even know what the other part of it is, but it relies on just your body weight. But your body weight could be made up of all sorts of things. So, but knowing your weight, and maybe your fat to muscle ratio, that would be helpful, or your fat composition, that would be helpful. But you want to know that. You want to know your blood sugar numbers too, because you want your blood sugar to be stable, because that can contribute to heart disease. That when your blood sugar is high, it causes inflammation in your cardiovascular system, because that sugar is considered a toxin in your system when it stays there. And so you want to make sure that number stays low so that you're not developing this inflammation in your cardiovascular system. Then that results in you developing plaque, which can cause all sorts of problems, including a heart attack. So maintaining those numbers at a healthy range, knowing them is powerful information. Then once you know them, whatever they are, whatever your baseline is, but if any of those numbers is out of healthy range, you want to do everything you can to get them into healthy range. One of the ways that you do that is you exercise regularly. So you want to aim for at least 150 minutes of moderate cardiac activity, aerobic activity. Running, walking at a brisk pace, whatever whatever it is that you do that makes you happy, dancing, playing with your kids. If you can do 150, which is 5 30-minute sessions a week. Or you can do 75 minutes of vigorous exercise. So that would be playing basketball or running or whatever it is that you do. And so that would be like 2.5 days of 30 minutes each. But in 2023, there was a study in the European Heart Journal, and they found that women who exercised at this level had a 24% lower risk of heart disease compared to inactive women. That's pretty significant. Next thing is you want to maintain a heart-healthy diet. So what does that mean, a heart-healthy diet? That doesn't mean that you just eat rabbit food all day long. Although going plant-based is certainly not a bad idea when it comes to protecting your heart. Because if you're not eating animal products, you're not ingesting that cholesterol, among other things. There's all sorts of things going on there. There are hormones and there are chemicals and there are antibiotics and all kinds of stuff too that you're ingesting along with that meat, because all of those things were fed to the animals. So you want to eat a diet that's rich in fruits and vegetables and whole grains, not quick cooking stuff. You want the whole grains that take a little while to cook. You want lean proteins and healthy fats. And so two of the diets that encouraged, that people are encouraged to use, are the Mediterranean diet and the DASH diet. And anybody who wants help with that, let's get together for a free consultation. Excuse me. You want to also manage your stress. So chronic, unrelenting stress has a huge impact on your cardiovascular health. So you want to use meditation. You want to use techniques like meditation, yoga, physical activity, as exercise helps to alleviate a lot of stress. Mindfulness, deep breathing. So certain breathing exercises. These are all things that I encourage and teach my clients to do. A 2022 study in JAMA, which is the Journal of from the American Medical Association, found that women who practiced mindfulness meditation had a lower blood pressure and reported less stress. So that's really good, because you can't get rid of the stress. Stress is part of life, but what you can do is manage it. And that's the important thing, is managing the stress so that you are not, you're not reacting strongly to every single thing that happens to you. You're able to downregulate your nervous system. And whenever you do these exercises, these meditations or the breathing exercises or whatever it is that you're doing. Next thing is, don't smoke at all. There is no amount of alcohol, smoking of tobacco that is safe and healthy. Don't smoke, and limit alcohol. And I mean limit alcohol, because there actually is no amount of alcohol that's safe. Anybody who tells you that red wine is heart protective is talking about the resveratrol in it, which is what makes it red. You can get that same resveratrol from dark red fruits like grapes, purple grapes, or beets. There are other things too, but I can't bring them to my top of my mind. So I just saw a thing on the news the other day that said that more than one drink a week for women is unhealthy. Now I don't know what the source of that was. I just heard this little blip on the news, which I thought was that's quite a change from one drink a day. One drink a week. To me, I don't drink. I stopped drinking when I was going through chemo, because I thought my liver had been through, and it was going through enough. It did not need any more torture. But I would really highly recommend that you drink very rarely. And when you do drink, make it one small drink. The next thing is something that does not get enough attention, and that is sleep. Sleep is and there's doing more and more studies on this, and it's imperative. It's become very obvious that inadequate sleep causes a lot of health issues. So what you want to do is you want to get 7 to 9 hours of deep restorative sleep every night, because poor sleep has been linked to heart disease, and especially in women. And women are notoriously bad sleepers, or sleepers, light sleepers. You have that mother hearing. So if you have children, you've got kind of like one eye half open, listening for your kids at night. But it's really important to get as much good restorative sleep as you possibly can, 7 to 9 hours a night. And practicing good sleep hygiene before you go to bed at night, which is something I teach my clients to do. Making sure that you keep electronics away from you at night, because those EMFs are bombarding you all night long. There are a number of different techniques to set you up for a good night's sleep. And then this is not something that I particularly like, but aspirin therapy. So taking a baby aspirin, which is 83 milligrams, I think, a day, under a doctor's care. Don't ever do it on your own, because it has other side effects that you might not be so keen on, like internal bleeding. There are other things that taking daily aspirin can cause. So if the risk outweighs the benefit of you taking an aspirin, don't do it. If it's beneficial for you, because it's a blood thinner, so it keeps your blood from clotting, so that you don't have a stroke, or you don't have a heart attack, or at least you minimize you bring down your risk. I don't know how much you minimize it, but if your doctor recommends it, then you take it. But I wouldn't do it just willy-nilly. So even if you have been eating badly, or eating foods that don't necessarily serve you nutritionally, or you haven't been exercising, or you haven't been taking care of yourself, it's never too late to start. It's never too late. You can always start from wherever you are Start small, because if you try to jump off that whole bridge, you're going to hurt yourself. So start small and make small incremental changes that are sustainable for the rest of your life. Because you don't want to make this isn't just a short-term fix. This isn't like, all right, I'm going to lose 10 pounds and then I'm going to go back to the way I was. Because the way you was is what got you here in the first place. So, to recap, we know that heart disease is the leading cause of death in women, surpassing all cancers, everything else. And there are so many people that don't even know that. They actually, back in 1990 something, more people, maybe 45% of women realized that heart disease was the major killer, the main killer of women. That number has gone down to about 30-something%. I don't know why. I don't know. Because it's not getting enough focus, I think, is the problem. So, heart disease is the number one killer of women. Remember that. Women have unique risk factors. That include hormones. That includes breast cancer treatment. That includes pregnancy-related complications. That includes not recognizing symptoms. So there are and then medical intervention that isn't taken. That the medical professionals aren't taking you seriously. So our risk factors are different. Our symptoms are different. They're not as severe as men's, or maybe we have a higher threshold for pain. Not sure which is which. Maybe both, but our symptoms are different. So if you're having a series of symptoms that you don't recognize in yourself, that you haven't had before, that are on sudden onset, get it looked at. And if the doctor's not taking you seriously, find another doctor. There are plenty of doctors who will take you seriously. I would recommend a female doctor, quite honestly. Diagnosing in women is difficult, as we've said. Diagnosing, because we use everything is based on the male body, the diagnostics may not be accurate for women. So we got to be really careful about that. But the tools are becoming more and more. They're developing new tools every day, and they're bringing more awareness to women's heart health. So women are going to be considered as part of the development process. And then we talked about prevention strategies. So. Regular checkups. Make sure you're seeing your cardiologist regularly. Even if you don't have a heart condition currently, get a baseline so you know where you are. And then if there are changes from that, you know what's going on. So you want to make sure that if changes are occurring that are leading you in that direction, you want to do something immediately to stop the progression of whatever's happening. And that's where people like myself come in. I'm a coach that helps you to prevent the onset of these chronic illnesses. So make sure you get it. You take these matters into your hands. Be an advocate in your own health care. If you have a doctor who doesn't allow you to ask questions, get another doctor. If you have questions, make sure that you write them down before you go to your doctor's visit, so that you have especially if you're getting news that is not necessarily pleasant. If you have that piece of paper in your hand, so that the noise in your head isn't overcoming you, so that you can't remember the questions. Have the questions written down and expect that person to stay with you and answer those questions. And if you're not getting satisfactory responses or answers from this doctor, then get another doctor. Doctors are under a lot of pressure to move patients through the system. So they may not necessarily want to sit with you and answer your questions, but they are working for you. So if they're not willing to do that, there are doctors that are willing to do that. My cardiologist is amazing. And she listens. She lets me ask my questions. She listens to me. She also is very conservative when it comes to medicating. So she will give you an opportunity to take care, to try to change things for yourself. If you are on the cusp of needing medication, there are some doctors that say they want you to take it preventatively, prophylactically. I am not one of those people who will do that. I don't want to take a medication just in case. If you give me the bad news, I'm going to do what I can myself to turn that around before I end up having to go into a medication situation. Now, when I had the cancer, I didn't want that cancer to progress. It was an aggressive cancer, so that was a different situation. But when I had the heart attack, and when you have a heart attack, they give you a cocktail of drugs. They give you a statin, a blood thinner, blood pressure medicine, and there was one other thing I can't remember. But I had reactions to everything. And I didn't have high cholesterol, and my heart attack was not caused by a blood clot. My heart attack was caused by a flap of my artery, and I didn't have high blood pressure. In fact, I had low blood pressure. So they put me on these medications. I had reactions to everything, and I asked them to take me off. There was no reason for me to be on these drugs. So I did. The type of blood pressure medicine that the doctor gave me was to keep my heart rate low. I don't know why. I guess it's because they don't want me to have another SCAD, but I guess it's to keep my heart from having to work too hard. And so I did stay on that blood pressure medication. But then when I was in cardiac rehab, they couldn't find my blood pressure one day. They couldn't find my pulse or my blood pressure. So then my doctor lowered my blood pressure medicine to the half of the lowest dose that they make, which was okay. So I take a half of a pill every day. And I doubt that she'll ever recommend that I come off of that thing. And that's, if that's the only medication I have to take for this, I'm okay with that. So, if somebody just wants to throw pills at you and send you on your way, question that. Why am I on these medications, and what should I expect as a result of taking these medications? And if they don't want to answer that, another doctor. Definitely walk out. So advocate for yourself. Make sure that you are asking the questions. Trust your instincts. If you think there's something going on in your body, there probably is. Trust your instincts and stick to your guns. And doctors can be intimidating. I know that. I get that. But don't let them intimidate you into a heart attack that's going to kill you. So just remember that. Remember all of these things. I would love to give you a free consultation, and we can talk about what your situation is. If you have been diagnosed with something, if you have been told that you may very well likely be diagnosed in the near future of this, whatever this something is, if you don't do something about it, let's talk, because I can help you get yourself on a healthy path. And if we decide to work together, great. If not, you'll at least have started on your healthy path. So that is it for today. I'm Karen Sammer. My business is Your Power, Your Health, Nutrition and Health Coaching. And I will see you next time.